Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery. We thought it'd be fun to maybe have some videos about, is this normal? Every time I see patients, a lot of patients come in with some anxiety about changes that they've seen in their body. And as humans, we always feel like if we notice something on ourselves, we're the only ones that have it. So in this segment, I'd like to just address some of these common misconceptions or worries that patients have. A couple of reasons. Number one, to sort of alleviate maybe some of the anxiety you might be feeling, but also to let you know that some of this can just be easily rectified and fixed in small procedures. So I think some of the big ones we want to talk about, we're going to start with breasts because that's the most common thing. I think a lot of women feel very self-conscious about their breasts. And I want to make sure you understand that a lot of times it has nothing to do with what you did or didn't do, development-wise, and as we go through life. So let's kick it off and we'll hit some of these for you.
Is it normal for one breast to be bigger than the other?
This is probably the most common problem that women seek my advice about. And so, yes, it's very common. And again, had nothing to do with what you did or didn't do during your development. It's just, we always have asymmetry. As we all know, one hand is bigger than another, one foot is bigger than another. And these might be slight things and slight variations. Same thing with a woman's breast. But if you notice on men's chests, if you look closely, there's asymmetry there as well. So sometimes, in most cases, the asymmetry is subtle. You might think that, might want to see one breast being a slightly fuller, and that breast just has a little bit more breast tissue. The other breast may just have a little more fatty tissue, but there is normal asymmetry. It can also be as common as one breast being an A cup and the other breast being a D or a double D. And again, it's all developmental, it's nothing you did, but they can be rectified. And a lot of times when there's subtle asymmetry, women are coming in and we're talking about implants and augmentation, and that can be easily overcome by using a slightly different volume of an implant on one side versus the other. When there's a little more asymmetry, then sometimes a breast lift on one side would be needed, maybe even a reduction on one side. So all of that can be rectified, but just to assure you, breast asymmetry is extremely normal, just as it is to have normal, volume on both sides.
Now, why do I notice my breasts changing?
Another problem is that women that come in, and this is a misconception that women will come in and say, my breasts are sagging. I've had, a family now, several children. I'm losing some volume, but now my breasts are sagging. In many cases, the breasts aren't sagging, they're unbalanced. So as a woman goes through life, no woman retains fullness in the upper part of the breast called the upper pole. And so breasts naturally have a more concave look on the top and a little fuller on the bottom. That's a normal breast that women have. Now, your genetics, your lifestyle, weight gain, weight loss, breastfeeding, pregnancies all influence that. But even if you have not had any of those, just going through life, you're going to lose that upper pole fullness. Now, when we talk about sagging or what's called ptosis, it's really the relationship of the nipple to the level of the inframammary fold. So many times women feel their breasts are sagging because they have this loss of volume up top and fullness on the bottom. That's an unbalanced breast, but the nipple and the areola are right at the inframammary fold. So that's just an unbalanced breast. In some cases, when the nipple and the areola start hanging below the inframammary fold, yes, then there's some sagging and some ptosis. Both of those can be rectified with breast augmentation using implants and sometimes a breast lift. So all of that can be changed. Just, come in for an evaluation and that's how we would fix it.
Is it normal for my nipples to look different or change?
Absolutely. So one of the biggest questions when women come in are, and it's very sometimes scary to even ask, why are my nipples different? Obviously we see people in the office. It's a very safe place to ask your questions. It's important to understand that your body changes all the time. It can be pregnancy, it can be weight loss, it can be menopause, the start of menopause. So many things change, which means the shape of your nipples also change along with color or pigment. There are times too, is if one breast is smaller than the other, the illusion is even more. And sometimes that really makes us feel insecure. But coming in and talking about it and asking your questions are so important because our bodies continue to change, and so does our appearance.
Is it also normal to have hair around my nipples?
Hair around the nipples is actually very common. Most people don't want to talk about it, but when they come in, again, I can't say enough, this is the place to ask the question. So education-based, so important to make you feel comfortable about the changes that you're having in your body. So nipples can have hair. They can be around the areola or on the outside where the pigment changes to your breast tissue. We have a lot of things that we can use for that. One of the biggest is our Modus, is laser hair removal with zero pain. And that's something you could talk to your provider about because we can assess that during one of your appointments or even your consultation.
Is it normal to have hair on my face as a woman?
So hair on the face as a woman can be just defined as so many things. You can have a few hairs in what we would consider the upper lip or mustache area. You can also have here at the chin area, sometimes even under the submental area. So when you come in to see us, your goals are easily achievable with a Modus, which is a laser hair device that has zero pain. Also, too, is when we think about hair, some people feel it's excessive, and that could be 1 to 2 hairs. That could be a full mustache, depending where you are in your cycles. If you're perimenopausal, if you've been in menopause, you've had changes in hormones in general, this can be something new that you're dealing with. So coming in, talking to us, talking to one of the providers, getting a consultation, making sure that we can achieve your goals in a good clinical standing, very important. Also, too, is pigment is a huge thing with hair, and so we can also address that when you come in.
Is it normal to have uneven facial features?
Yes, that's another common issue that patients have concerns about. So you may not notice it as you're younger because our faces are fuller, we have more fullness in the cheeks along the lower jawline. So as we age, we start to lose some of the fullness in our face. Some of the facial fat starts to atrophy, but it also starts to shift down and forward. As things slide forward, that's a time when patients are starting to notice some changing, some early signs of aging. And what they'll notice is that one cheekbone might not be as prominent as the other. You might start having a little bit more hollowing on one side than the other. Brows position is another one where they'll think, what's going on? I have one brow that's a little lower than the other brow. A little more excess skin on the upper eyelids on one side versus the other. The other thing is lines around the mouth. One side, what we call the nasolabial folds, might be a little deeper than the other side. So these are all subtle facial asymmetries that are of the bone underneath everything that we don't notice when we're younger. But as things start to change, we lose some of that fullness and the camouflage. Those bony discrepancies are now brought to the surface. So patients will come in, and what I usually do is have them hold a mirror and show them right away what side is more prominent, one side isn't. And that side that's not as prominent, that's where they'll see a little bit lower of the brow, changes in the cheeks, a little bit deepening of the nasolabial fold. And once I point that out, then, I explain to them why that is normal and everybody has it. They can see it on me when they look at me. So I want to make sure that it's just normal. Now, that can be rectified by fat grafting. It can be rectified with dermal fillers and also facial rejuvenation surgery, neck lifts, facelifts. So all of that can be rectified over a course of a surgery or even in the office. So depending upon what your goals are, we can certainly address them.
Is it normal for my skin to sag even though I'm healthy?
Yeah, that is another issue that we're seeing even more today, but it's common to have skin. Remember, as you age, your skin will thin a little bit. The dermis, which has all the elastic fibers, and so those kind of the little stretchy rubber band properties that help the skin redrape as, when we're younger, as we lose weight or our body changes, it kind of stretches back and forth with the rest of your body. However, as you age, especially women, so women start to thin out their dermis about early 30s to mid 30s for sure. Men, it's a little bit delayed. Estrogen and progesterone are big culprits in that. So as you age, your skin is not going to be able to respond as well as when you are younger. So we're seeing patients now very frequently with weight loss due to diet and exercise, better eating habits, your change of lifestyle, still surgical with the gastric bypasses, gastric sleeves, and now with the onset of all of the GLP-1s that patients are using successfully to lose weight, we're seeing that a lot. And, and when we see them, especially with the GLP-1s, and the gastric bypass patients, the problem with that is, are they eating enough? Are they getting enough protein, minerals, the amino acids that help continue with that skin health? And that's not talked about. And I think patients are missing it. They're losing weight, they're happy, but now they're starting to see the problems that arise when you're still not taking care of yourself. So
Yeah, absolutely. So just kind of to add to that also, when you start losing weight, it's great. You feel good, but there's this rapid weight loss that we see some people, not everyone, but regardless of how fast you're losing, it's like you said, getting the albumin, making sure you're getting your protein in, making sure you're actually getting your vitamins, that you're absorbing your vitamins. So a lot of rapid weight loss, we're left with excessive skin. It's thin, crepey in some ways. So 30, 40-year-olds coming in with crepier skin. But then there's also when you're losing it appropriately, and that's based on your provider and that maybe it's your dietitian, your personal trainer. There's ways that we can kind of help tighten that and ways to kind of boost your collagen. So that would be our Virtue Smart or our Virtue Deep. They target the collagen production. Deep actually helps with some adipose tissue and also some skin tightening. And then we can follow that up with our Helix laser to resurface that. And so giving the texture a nice smooth appearance again. But all of that is based on where you're at in your journey. That's something you can do in the beginning, middle, and towards the end. Not necessarily something that people are quick to decide. We'd like you to have that conversation, like to talk to you about where you're at in your journey. Whether you're just starting or you're planning to start, regardless, there's always an option and what kind of to achieve that goal. So
right. And so, and again, it really, you have to start thinking about, especially with the gastric bypass sleeve and the medications, you're not hungry, you don't eat as much, you don't have the capacity to eat as much. So you still really now have to concentrate on the vitamins that you're going to be missing, the amino acids, the proteins, all of those things build healthy, not only just muscle, but also healthy skin. Now, when you start having a lot of excess skin, then we have to start looking at other things. Sometimes our lipo AI device, which is laser lipo, can help internally through a tiny incision, help heat the tissue and stimulate that collagen from underneath and try to tighten it a little bit. There's a limit to what that can do as well, just like the Virtue. And then there's just going back to surgery and removing the excess skin, tightening that tissue up. But remember, your skin is going to continue to age. And so we always have to think about stimulating the skin. And as you get to the gym and you're building muscle and you feel better, remember your skin doesn't respond to that like muscle does. And so your lifestyle, eating healthy, stop smoking, even alcohol intake, making sure you're getting all of those amino acids, the proteins, the vitamins that you need. You have to really concentrate on that. So yes, there are, depending upon where you're at along your journey, what your goals are, all of those modalities are available to you.
Why do I have cellulite even though I'm healthy?
That's another common one. So cellulite is an anatomical structure, and some patients have it and some patients don't, but we all have the attachment. So basically, if you think of the top of a mattress that's kind of quilted, your skin is attached to the muscle below through these little fibrous bands, and they hold the skin in place so that when you're moving, the skin moves with the muscle activity. Some patients, that's a little bit more prominent, and it's made worse if you start to gain a bit of fatty tissue, that those fibrous bands don't expand, and so they pull the skin down even more. So it's a common problem that we see. I'll have Ange talk about maybe some modalities. It's something that, patients will come in thinking liposuction will take care of. Liposuction is not a good choice, so I'll just throw that out there right now. It might help improve it. It won't cure it, but you have to be careful with liposuction. And the thought is that would be because you remove some of that fat tissue, it should just go away, and that's not the case.
So a lot of times with cellulite, it's texture, it's the appearance, like you said, like a mattress. And so sometimes people will say I have these divots and I'm not sure how to get rid of the divots. So there's times we can do SMART, or we can do a deep virtue in that area, and then somewhat tighten the skin, boost the collagen that's still there. And then again, for the texture side of things, using our helix laser for resurfacing. It's stubborn, I have to say that. And I think it's probably one of the biggest common questions that people will ask and say, what do I do to get rid of this? And unfortunately with marketing, they're marketing creams and lotions. And unfortunately, a lot of times that's just good marketing on a company's part. And so understanding what's actually available and what can actually treat the areas, again, with consultation.